Britta S. 8 months into the COVID-19 pandemic, 72.4% of healthcare workers at a medical center in Baltimore, Maryland reported high health fear. This is according to Michael J. Van Wert, a licensed clinical social worker with a master's degree from Johns Hopkins in the Journal of General Internal Medicine, published in 2022. Everyone in this room experienced the COVID-19 pandemic and knows a healthcare worker. The U.S. Department of Health and Human Services should increase funding to help with healthcare workers' mental health. First, I will talk about how the COVID-19 pandemic affected healthcare workers' mental health. And second, I will explain how increased funding for mental health resources will greatly benefit the workers. Let's begin with the effects of the pandemic and influences on patient care. The COVID-19 pandemic had a drastic effect on healthcare workers' mental health. Although every worker had a different experience, it affected a majority poorly. According to Rima Styra, who has worked for 28 years in psychiatry at University Health Network, in the journal PLOS1, published in 2021, fear, anxiety, and distress are natural human reactions to emerging diseases, such as COVID-19. So it fits that in a previously mentioned survey, 50.1% of healthcare workers reported high job stressors during the pandemic. This is shown to lead to depression, anxiety, sleep disturbance, high burnout, low resilience, and even PTSD symptoms. Healthcare workers cannot properly do their jobs if they are feeling or experiencing any of these things. Healthcare workers were routinely exposed to ethical conflicts during the COVID-19 pandemic. According to Siobhan Hegarty, who has been working as a psychotherapist for 7 years in the European Journal of Psychotraumatology, published in 2022, healthcare workers were routinely exposed to ethical conflicts due to inadequate staffing and resources. This made workers feel unequipped and or undersupported to respond to a crisis like COVID. Pre-pandemic government underfunding of National Health Service is directly linked to the systematic organizational issue of understaffing. This understaffing led to strained working relationships, which causes inefficiencies in hospitals and other care facilities. Frequently, workers felt forced to act outside of their care competencies, which is bad for the patients and causes moral injury in workers. Moral injury is known as the strong emotional cognitive reaction to events that clash with someone's moral code, values, or expectations. This psychological toll led many workers to consider leaving their role, thus making the understaffing even worse. Aside from the workers, patients suffer from the inadequate staffing and care. Now that we understand how the COVID-19 pandemic had a negative impact on healthcare workers' mental health, I will go through possible options to combat this problem. The U.S. Department of Health and Human Services must increase funding to help with this issue. According to Andrew J. Smith, who has a PhD in clinical psychiatry from Virginia Tech in the journal Social Psychiatry and Psychiatric Epidemiology, published in 2022, more people across a more diverse spectrum of functioning are in need of mental health support. So these resources must be available for all workers, from entry-level positions to department heads or managers. But we do not have the formal resources to meet this demand. That's why increased funding would greatly help. With the increased funds, we could create preventative and positivity-promoted approaches. According to Eden David, a professor in the Department of Psychiatry at Icahn School of Medicine, in the journal Psychiatric Quarterly, published in 2021, preventative resources include self-care resources, recharge rooms, and psychological and non-psychological training exercises. Ways to promote positivity are to involve healthcare workers in the interventional design, create peer support groups, and supply spiritual or faith-based resources. Implementing these for healthcare workers could greatly benefit their mental health. In this speech, I first talked about how the COVID-19 pandemic had a negative impact on healthcare workers' mental health. And second, I explained how increased funding for mental health resources would greatly benefit the workers. The U.S. Department of Health and Human Services should increase funding to help with healthcare workers' mental health. If we apply my solution, hopefully the 72.4% of healthcare workers with fear at work will go down and proper care can be administered to everyone in need.